Minister, in August we learned of a HSE proposal to limit homebirths to women and families who live within 30 minutes of a maternity hospital. This would have far-reaching consequences for families in rural areas who would be denied access to these maternity services. Home birthing will be prohibited in large areas of Cork, Kerry, Clare, Galway, Mayo, Donegal, Monaghan and Wicklow. This will impact thousands of families. The proposal was greeted with shock from midwives and women. The Midwives Association of Ireland and the Community Midwives Association have come out strongly against this plan. On Sunday, there was a large protest outside Cork Maternity Hospital. Families, parents, grandparents, children all turned out opposing this attempt to remove people's choices. Those who it directly impacts do not want this. The healthcare professionals who run the service do not want this. Why is it being proposed? Who is pushing this agenda and why? This must be a political or a managerial decision because it is not evidence-based. Home births are safe. The current systems function well. They should be improved and developed, not shut down. Community midwives provide an incredible service, and this plan is doing them a considerable disservice. From experiences with friends and family, I cannot speak highly enough for the care and caution provided by community midwives. It's disgraceful that the HSE and government do not appreciate this. The report on this proposal has no evidence base. It refers to an evidence review from 2015 and states, and I'll quote directly, Minister, "At that time, no studies were found that focused on transfers from standalone midwifery-led units or home births and any adverse outcomes." The report itself admits it has no medical basis for this massive policy change, so why is it being proposed? I have to repeat the question: who is pushing this and why? Can the Minister clarify if this is a political decision? The HSE are perpetuating a misconception that home births are not safe. They are safe. If they're so adamant that expectant families need to be within 30 minutes of maternity hospitals, perhaps they need to look at providing maternity services in West Cork and other rural areas. Because this is the utterly ridiculous basis of the plan. If home births can only occur within 30 minutes of maternity hospitals, then all pregnant women should never be more than 30 minutes from a maternity hospital, as they can go into labour at any stage. We should have birthing clinics and midwife-led services across rural and urban areas, supported by well-resourced ambulance services. Why instead is the HSE being permitted by the government to ban home births in rural Ireland? Rather than addressing the actual problems with the maternity services, time and energy is being wasted on this plan, which has excluded midwives and has left thousands of families deeply worried about their reproductive choices. Minister, in your response, can you outline what plans are in place to address the more than 100 unfilled posts in maternity services in hospitals in Munster? The staff shortages in our maternity services have been described as critical this week. Midwives in Tipperary University Hospital have warned that staff shortages are causing risks to the safety of women and babies. What is the HSE's response? To force more families into already overstretched hospitals. In this context, the plan is not only not evidence-based, it is irresponsible and it is dangerous. You have to stop it now, Minister.
Thank you, and thank you, Deputy Kieran, for raising this important issue, and I acknowledge your ongoing work in the area of women's health. And as you are aware, the HSE's National Home Birth Service moved from community operations to acute operations within the HSE earlier this year. And the Home Birth Service has now been integrated into the maternity networks in line with the National Maternity Strategy. I think the core aim of that strategy is to provide safe, high-quality maternity care to the women of this country. And as part of this transition, the HSE's National Women and Infants Health Programme was asked to provide more specific guidance at national level regarding the appropriate distance a woman should live from a maternity hospital while accessing home birth services, and to make a recommendation on this issue. Using both obstetric and midwifery expertise, the NWIHP issued national guidance on home birth on the 14th of July, recommending from a clinical perspective that it would be safest that all women accessing the HSE's home birth services would reside 30 minutes or less blue light distance from the nearest maternity service. When making this recommendation, the NWIHP took into account a range of factors, including the historic transfer rate into maternity units of mothers who laboured at home in the National Home Birth Service, the primary reasons why women were transferred, the method of transfer, the need to factor in ambulance response times, the time needed to transfer the women into an ambulance, and the time until access upon arrival at hospital. The HSE's recommendation addresses the balance of risk that needs to be considered for home birth services. And for example, if a woman has an emergency in a maternity hospital and a Category 1 caesarean section is required, the woman must get to theatre within 30 minutes. In the event of a serious risk to a mother or baby in the HSE's home birth service being identified by the self-employed community midwife, this recommendation is designed both to ensure the best possible chance of getting to a maternity hospital in a timely manner, to ensure the best outcome for mother and baby, and to ensure that the clinical determination of the self-employed community midwife is acted upon in a safe and timely manner. And while I understand that the HSE's recommendations has caused concern for some, it is important to note that a geospatial analysis carried out by the HSE indicates coverage will remain for 83% of the female population of childbearing age. And while the home birth service represents only 0.7% of overall births, the HSE and an NWIHP recognise that it is an extremely important pathway for women. To conclude, Concur, I'd like to note that while choice for women is an integral part of our maternity services and the National Maternity Strategy, the need to ensure safety must always be paramount. And the objective of this measure is to enable the continuity of the home birth services while ensuring the best outcomes for mothers and babies in line with the objectives of the National Maternity Strategy.
Minister, I don't understand what you mean when you say that from a clinical perspective, because like I said in my opening remarks, that the report on this proposal has no evidence base. It refers to an evidence review from 2015, and I'm going to quote it again. It says, at that time, no studies were found that focused on transfers from standalone midwifery-led units or home births and any adverse outcomes. So when you talk about a balance of risk, I think you need to actually specify what you're talking about, because I think you too are perpetuating that misconception that home births are not safe. You say things like best outcome, timely and safe, but what are you basing that on? Because there is no evidence to say that home births are not safe. And I have to presume, Minister, that you don't actually realise the reality of them, that you're seen so often throughout your pregnancy and very often then referred to the hospital. This is only allowed to go ahead if the pregnancy is suitable for it. It's not what you're making out that it is, and I think it's something that you need to look into. And I'm still unclear about the motivation for the plan, who's pushing for it. None of the relevant stakeholders want it, midwives are opposed to it, families are protesting against it. Again, there is no evidence to support it. This is about quality maternity services and reproductive choices. Home births are safe. They are the preferred option for many families. The government and the HSE should be supporting people, not restricting their healthcare options. And Minister, I really encourage you to genuinely look into this instead of reading off that script, because it's misinformation. A ban on water births is another limitation on reproductive choice. The Midwives Association of Ireland have called this ban also non-evidence-based, unethical and inequitable. Minister, you must also be aware that the ban will put some women and infants at increased risk. There are people who, for personal reasons and convictions, will have a home birth regardless, and they will be intentionally left out without healthcare professionals now if this goes ahead. Minister, this is about reproductive choices and maternity healthcare that is genuinely centred on women and families. Unless you intervene, it will in essence be your government's policy that bans home births in rural Ireland?
Minister, to conclude.
To conclude, Concord, I'd like to state that the Government and the Department of Health do remain fully committed to implementation of the National Maternity Strategy, including development and delivery of home birth services. I think the 30-minute blue light distance recommended by the HSE's National Women and Infants Health Programme, I think it seeks to ensure that as many women as possible who wish to can access HSE home birth services in a manner that ensures the safety of both the mother and the baby. In making this recommendation, the WIHP has taken into account many factors associated with home birth services, and having looked at those factors using obstetric and midwifery expertise, the NWIHP has sought to address the balance of risk that needs to be considered before providing the choice.
Could you
of
publish
home
those
birthing
factors then?
And the safety of the service for the mothers and babies in the care of our maternity services. Conclude, Corla, I again acknowledge that this has caused huge concern for some, and that a small number of prospective parents are disappointed as a result. And I want to thank you, Deputy Cairns, for raising this important issue. But it is important to reiterate that guidance issued by the HSE is based on a clinical perspective, and the recommendations will help deliver safe outcomes for those accessing the services. And the Department of Health and I will continue to work with the HSE's NWIHP to ensure maternity services continue to develop in line with the National Maternity Strategy. You've raised a few concerns, Deputy. If you wish to email me them, I will raise them in the department.
If you could publish those clinical decisions you keep speaking about, because
I will raise them. I will raise them.